Good evening and a warm welcome to the Albert Luthuli Leadership Institute, the ALI, Masters in Development Practice webinar. My name is Dr. Jolanda Steenkamp, and I am a Senior Lecturer and Program Manager of the MDP, the Masters in Development Practice program at the University of Pretoria. The MDP is an international interdisciplinary program aiming to equip development practitioners to be leaders in their field, understanding the dynamic interlinkages between the UN Sustainable Development Goals, the SDGs, and able to partner with the appropriate stakeholders to implement the SDG targets effectively. I would like to extend a warm welcome to our panelists, all of them distinguished leaders in their field. Professor Tiaan de Jager, Lynn-Marie Burkholz, Veronica Uckerman, and Dr. Mthokozisi Zibanda. I will introduce each of them in more detail as we move through the program. I would also like to welcome Professor Stephanie Burton, the UP Vice Principal for Research and Postgraduate Education, as well as Professor Elsevier Lewitz, the Dean of the Faculty of Economic and Management Sciences, Professor Barend Erasmus, Dean of the Natural and Agricultural Sciences faculty, and Professor Derek de Jong, Director of the ALI, and Professor Alex Antonites, Head of the Department of Business Management. A warm welcome also to the Global Association of Masters in Development Practice students and faculty from the 37 universities who offer this program across the globe, of which UP is one of only 4 on the African continent. Welcome also to Dr. Lucia Rodriguez, who joins us as Secretariat of the Global Association at the New York office of the SDSN, the UN Sustainable Development Solutions Network. What a mouthful. I hope all of that just fills you with a due expectation that the contribution from our panelists will keep you at the edge of your seat tonight. The purpose of these webinars, and tonight is the second in a series of 3 for the year, is to highlight the importance of leadership in implementing the SDGs, and specifically the unique leadership requirements posed in the context of complex collaboration across sectors and disciplines in order to address SDG targets. The best way to do this is to look at case studies where researchers and practitioners really succeed at doing this. And tonight our case study is malaria elimination, specifically some of the fascinating work done by the UPISMC, which is the University of Pretoria Institute for Sustainable Malaria Control. Since we aim these webinars especially, but not exclusively, at our global MDP student audience, I want to take a moment to welcome each of you as you may be tuning in from anywhere in the world. And that includes our own students here from UP as well. To our audience, you are most welcome. I hope that you will find this evening informative and very interesting. And with that, I would now like to introduce our first speaker. Professor Tiaan de Jager is Dean of the University of Pretoria Faculty of Health Sciences and also Director of the UPISMC. I will say this one more time, that is the University of Pretoria Institute for Sustainable Malaria Control. You may hear this abbreviation as the evening continues. Professor de Jager is in his second term as appointment as Dean to the Faculty of Health Sciences at UP, with an academic appointment as a professor in environmental health. His primary research focus is on male reproductive health, specifically related to environmental health and toxicology, where he investigates the effect of endocrine disrupting chemicals, EDCs, including insecticides used for malaria vector control, on these systems. His research and recommendations have informed international and national policies on water management and sustainable malaria control. Professor de Jager is dedicated to building research capacity and promoting science in Africa. Tonight, Professor de Jager will introduce the audience to the UPISMC, the Institute's transdisciplinary research and holistic collaborative approach towards malaria elimination, and how this aligns with various SDGs, addresses SDG challenges, and vice versa. He will also address the importance of leadership and management in the malaria control and elimination space. Prof. Deon, it is a privilege to have you with us tonight. You are welcome to continue. We are so grateful to have you. Thank you.
Thank you, Dr. Steenkamp, and thank you for the invitation. Colleagues, a warm welcome from my side as well. I think this is an example of transdisciplinary approach towards a problem. Two of the University of Pretoria institutes collaborating and addressing some of the national challenges and building capacity in areas that is needed. I'm going to share my screen with you. If you can just confirm that it is visible, the slide.
We can see it. Thank you, Prof.
Good. So yes, I'm gonna spend a few minutes talking to you about the transdisciplinary approach, and this is what is unique of our Malaria Institute. Compared to other entities where there's maybe a focus on the mosquito or the vector, or specifically in drug development, our approach is an integrated approach, a transdisciplinary approach, and specifically addressing the malaria issues, working towards malaria elimination. Now, there's various levels of leadership needed. In South Africa, we've got the national government, the provincial government, local governments, and these each got a task to eliminate malaria. So you need leaders in those programs to be successful. And therefore, I think the Albert Luthuli Institute is playing an important role going forward, not only for South Africa, but for Southern Africa and the continent. So you're all aware of the Sustainable Development Goals. It is important that we commit towards addressing these goals. So we collaborate with the South African government and other entities, the elimination aid countries, and then once again, the Albert Luthuli Institute is also known for their work and managing some of these SDGs and the reports going forward. So what I'm going to try and illustrate is how the different Sustainable Development Goals are interlinked. Just a short summary in terms of malaria, and then the need for the leadership and the management of malaria. Then our institute, the University of Pretoria Institute for Sustainable Malaria Control, as a vehicle towards elimination and how we structured it. And then I'll close off by highlighting some of the leadership needs. So many of you have seen the typical blocks of the Sustainable Development Goals. Now, I think what is important to me is for us working in health and well-being, that's SDG 3, there in the corner, the green one, you need to address many of the other SDGs. Otherwise, you will not be successful. So we talk about poverty, a disease of poverty. So zero hunger, number 2, is important. We talk about water. That's the breeding place for mosquitoes. So you need to address the water issues. No poverty, there, number 1 in the middle. Many countries were successful in addressing the malaria challenges because they address things like water, sanitation, surveillance. It's an integrated approach. And then obviously, number 17, there, the blue one, partnerships partnerships, those collaborations, those networks is so important. You cannot do it in isolation. And then the green one, climate. This week we had a 3-day workshop funded by the British Council, specifically looking at climate change and the effect of that on malaria, and it formed part of the COP26. So we're very concerned about the changes in climate, and to be able to address those, we need to, the malaria issue, we need to make sure that we've got early warning systems in place, etc. So another one that I would like to highlight is number 4, education. Many of these diseases, in the past, the communities were excluded. It is important that we include them, that we educate them from a very young age. And I'll demonstrate some examples as we move on. So just to highlight, 3.3 in red there is end epidemics of AIDS, TB, malaria. So with maternal and infant health care, we were not successful previously, and therefore it is high on the agenda. But I would like to highlight another one, 3.9, reduce death and illnesses from hazardous chemicals and air, water, and soil pollution and contamination. Historically, what did we do to combat malaria? We used chemicals, hazardous chemicals. So that is part of the story. DDT, that has been used since early days, has got a long half-life, up to 60 years in the environment. And DDT itself has got estrogenic properties, and its breakdown product, DDE, is a potent anti-androgen. So various mechanisms involved in scrambling the hormone system, and this might be seen in what we call the urogenital syndrome, and things like infertility, undescended testes, prostate cancer, breast cancer in women. There's a whole list. And therefore, it is important that we use environmentally friendly ways, safer ways to combat malaria. So I just thought it's important to highlight that aspect as well. In the third column, 3D is strengthening capacity for early warning, risk reduction, and management of health risk. And that is where you look at your climate and weather conditions to predict your malaria condition as well, and you can manage it accordingly. So remember, we're talking management. Somebody needs to take the lead in putting systems in place, making decisions on control. What is going to be the best for a specific geographical area, because it might be differences within the different areas. So malaria is a complex parasitic disease. We find it in more tropical areas. Unlike other infectious diseases, it will result in complex interplay between the biological systems, the life cycle, the environment, the habitat, and the pathogenesis profile. Changing climate conditions, and another important one, the movement of people, may reintroduce a disease in areas where it might be successfully eliminated in the past. So it is an ongoing process. SDG 3, as I've indicated, includes malaria. And what is also important to note is that there's no one single way of combating malaria or getting to elimination. We need to develop a toolbox and decide what is going to be the best way of getting from the level where we control down to elimination. So new innovative ways, always important, because we know there's resistance and we need to try and be ahead of the mosquito, but also the parasite. And Professor Berghaus will tell you the parasite's actually very clever. So, in a nutshell, it is a major public health concern. It is a disease of poverty. Socioeconomic growth is affected by 25% per year because of malaria. It's treatable. The Anopheles mosquito is involved, the female. And then there's obviously the integrated mix between the different systems, the human, the vector, the mosquito, and the parasite. Now, it affects many people. About 3.2 billion people are at risk. The number of cases, 230 million cases about, with 410,000 deaths. And this is at the stage where we've been working for quite some time towards elimination, but we just don't get there. So 5 African countries account for 50%, more than 50% of the global cases. So Africa, we in South Africa, needs to address the African problem. And that is the challenge. 31 countries accounted for 95% of this. We know that it's in infants, pregnant women are at risk. But yes, then travelers and the mobile population across the borders. This is just a map to indicate, and the pink or red color is one or more indigenous cases. So you can see Africa, South America, and specific areas still at risk. Now, some of the challenges is specifically climate, and increasingly so. And I think for many years, governments ignored climate change and continued to use the same methods. So we started to see resistance, and all of a sudden, malaria in areas where it's never been before. So the problem became bigger. So new vector species moved in, cross-border movement of people, the resistance of insecticide and anti-malarial resistance, outdoor biting behavior. And you see the rest of the list there. And in many cases, a lack of good management practices and strong leadership. Ordering chemicals too late, implementing specific processes. There's no real data where you can work from. So yes, that is an important factor moving forward. Now, the World Health Organization, it various control strategies, and I'm very much aware of the time, so I'm going to move on. Your diagnosis, important. It is a treatable disease. So yes, but we need to reevaluate what we use on a regular basis. You might hear in the news, there's new vaccine trials, And the question normally is, will that end malaria? No, it will not. It will be another tool that will contribute and help us to get to elimination, but it is not going to let malaria disappear. Various ways, from indoor residual spraying and bed nets, and something that's getting more attention now is larviciding. But prevention is important, and we need to continue to educate people about that. Now, the leadership management of malaria, there are critical training gaps in the movement towards a global malaria elimination. Frontline workers, medical entomologists, there's hardly any medical entomologists. So if there's an outbreak, you need to send your team out. They need to identify, they need to report. And if you don't have people on the ground, or they don't have vehicles, or whatever the case might be, you're not going to get to that point. And then malaria-sensitive health system managers, policymakers, and leaders. So the research that we do at academic institutions should translate into policy eventually. And then the National Malaria Control Program, skilled leaders. We need to train these people, make sure that they will be able to take their best decision moving forward. So as a vehicle, the University of Pretoria Institute for Sustainable Malaria Control tried to build capacity and to include this in our approach. We've got 3 clusters: the human cluster, the parasite cluster, and the vector control cluster. Now, I'm going to quickly just give you an overview, and it's really a snapshot without going into detail or any scientific data. Your health cluster would focus on, obviously, your case management, and we see in South Africa that some provinces are very good at it. For instance, in Mpumalanga province, and therefore their numbers lower than in Limpopo. Early diagnosis and effective treatment. Then your environmental health, dealing with your conditions, climate change. Education and awareness. Where's the gaps? How should we communicate those messages? And as you can see there, within the University of Pretoria, a range of departments involved in this cluster. And just to mention that the University of Pretoria has got 9 faculties and the business school, GIPS, and they're all involved in the Malaria Institute. So it is a true transdisciplinary approach. Human and environmental health, and there's just some examples. We've got Cebu Fights Malaria, aimed at primary school children, because we believe if we're gonna educate the children, they will take the message home and educate the parents. The drama students performed a play under the baobab tree, and yeah, that mosquito was really scary. And I'm sure the children's gonna remember that. But various activities, music as a way to communicate messages. And we test these things and the effectiveness of this, obviously, in the different areas. Parasite control, and you'll hear more from Professor Burkholz, include parasite biology, surveillance, transmission blocking, and exciting things happening here. Collaborations, community of practice with other institutions, and bringing expertise together, doing hardcore science to get us to a stage of elimination. So drug discovery, very important, cell biology, structural biology, molecular biology, in trying to find that recipe, that secret, that platform to contribute towards the elimination agenda. Your vectors, resistance testing, biting behavior, and once again, the the Faculty of Engineering and IT playing a key role, specifically chemical engineering, in developing new strategies going forward. This is a slide showing some of the innovations. Polyethylene wall linings. We did 4 years of field trials and got amazing results. And you'll hear from other speakers about some of these innovations that came out of the Institute. So, UP Leadership, Management and Malaria, we've got platforms. We created rural platforms within malaria endemic areas from where we can do field work and operate. But at the University of Pretoria, we've also got Future Africa, where there's training programs, the Africa Science Leadership Program, the TICS Young Research Leaders Program. We've got in the faculty the Albert Sisulu Executive Leadership Program, and most of the malaria managers within government did that training program. We've got our business school, and yes, then the famous Albert Luthuli Leadership Institute. Yay! And it's so nice to collaborate with these experts because they can add value from their expertise to us that's trying to fight mosquitoes and parasites. So leadership, management, building capacity is extremely important going forward. And also, one of our strengths is our student forum. From different faculties, different departments, they go out into the field, work together in trying to make a difference. So in a nutshell, that's how we operate within the University of Pretoria Institute for Sustainable Malaria Control. Thank you.
Professor De Jager, thank you so much for this introduction to the world of malaria, because many people, I think most people on this call are like me, and we don't spend our days reading up on malaria. So thank you for this wonderful introduction. I would now like to introduce Professor Lynn Marie Burkholz, who is in the Department of Biochemistry, Genetics and Microbiology, Division Biochemistry in the Faculty of Natural and Agricultural Sciences at the University of Pretoria. And here she is the director of the DSI NRF South African Research Chair in Sustainable Malaria Control. And she's the head of the Parasite Control Cluster at the UPISNC. And she is the incumbent of a South African Research Chair in Sustainable Malaria Control and a professor in biochemistry at the University of Pretoria. She is the foremost researcher on malaria, parasite biology, and drug discovery in South Africa. Her research targets the interface between parasite biology and drug discovery, allowing for new biological insights and the discovery of new chemotherapeutical tools to deliver health innovations that contribute to the global malaria elimination agenda and improve human health and well-being. Professor Burkholz contributes immensely to the knowledge growth and training of emerging scientists focusing on malaria drug discovery. Tonight, Professor Burkholz will introduce the audience to the malaria plasmodium parasite and how its complex life cycle allows for novel drug targets to be identified for future development of new treatments to stop the spread of malaria. She will also touch on leadership aspects involved in managing a large research group and consortium with global impact. Professor Burkholz, thank you so much for being with us tonight. We look forward to learning from you. You're welcome.
Thank you very much for that introduction. I'm just going to start sharing my screen. If you can just indicate that this is visible.
Yes, thank you.
Great. Yeah, thank you. So I would like to thank the whole coordination team for this opportunity to talk to you a little bit tonight. And in the next 10 minutes or so, I'd like to use our research as an example of how I think transdisciplinary coordination can really contribute towards tackling malaria as a global health challenge. So I thank Prof. Tiago for his nice introduction to the UPRCC. And this is just my take on the definition and the nature of the UPRCC, which was really by design a transdisciplinary research platform, and really cements all of the research activities at the university in terms of three main biological entities that contribute towards this really complex disease. Now, as mentioned, my research focuses really on parasite control, and I direct the cluster on parasite control. And within this cluster, we have to look at multiple levels of investigation. We have to understand the causative parasite that causes disease. So we look at the parasite biology, but we also translate our findings directly into applicable outcomes, and we translate this into discovery of new antimalarial agents. And I'll try to just make sure that I define to you why this is important and how we go about doing this. But we also have a very novel innovation in our unit at the university, in the fact that we not only look at discovery of certain antimalarials that are useful in a therapeutic sense, but we also want to contribute, like I said, to global malaria elimination strategies. And we do this by looking at chemical tools by which we can use to block the transmission of malaria parasites. So this is something that's very new and can be seen as an add-on tool to our current control strategies of the disease. And that would sustain and elaborate the sustainability of our control tools into the future and hopefully lead to elimination. We then very effectively also integrate our work with field stations, and particularly our research station in Limpopo, where we look at parasite surveillance. So we really want to make sure that our lab findings has a translation into the field and has sense in terms of what happens in the field in the parasite load. And we also look at related malaria-like infections. But what I want to use this work for, and it's very academic work in a certain sense, but I hope I'll be able to illustrate to you tonight that if we are able to use all of this expertise and integrate it together, that we are able to have a successful transdisciplinary relationship, and that we can use this towards scientific innovation of definitely African-centered importance, but also global leadership and global importance. So we have now heard lots about transdisciplinarity and interdisciplinarity, so I'd like to just define this into my context. And as a scientist, I think per definition, scientist really works and scientific innovation is driven by singular events. And that's one scientist working within their discipline, focusing on their expertise and contributing those innovations in that context. But it's very, very clear that if we want to tackle complex problems, we as scientists cannot do this within our own disciplines, and we have to function within multidisciplinary teams. And that's the definition of multidisciplinary science approaches. So we would then have a number of scientists working together from different disciplines and each contributing their singular expertise towards a goal. However, it has become really important that for innovation to happen, that singular contributions needs to be integrated. And there has to be cross-pollination between the scientists within their expertise areas so that we can really have this interdisciplinary approach where scientists between different backgrounds and different disciplines are able to integrate their knowledge, and this can really lead to novel innovation. However, ultimately, all of this becomes really important and only meaningful when we approach this from a transdisciplinary view. And that is to say that our scientific findings has to have application, it has to be responsive. And by responsive, I mean it has to talk to what is the needs in terms of the society and other external stakeholders to make our findings and our important research from an academic sense useful within the communities. Again, for us in the malaria field, it is an African-centered community, an African-centered societal challenge that we are targeting, but we are doing so in this transdisciplinary nature, and we want to have our academic research and our academic findings here translated directly into outcomes that has meaning in those communities. So having said that, I'm going to now focus a little bit and introduce you to the parasite that is the focus of all my research. And this is, like Prof. Tiago said, I like to refer to it as a very clever little organism. It's a tiny submicroscopic parasite, And what it does do is it infects your red blood cells. So it's in essence, in terms of symptomatic malaria, a blood stage infection, a blood infection. And these little parasites then can grow inside your red blood cells to uncontrolled billions and billions of numbers. And by hiding away inside your red blood cells, it very cleverly invades your immune system, so your body cannot really respond very well to the disease in naive patients. But it also provides itself with unlimited resources. So unless we are able to treat a patient, it will have a massive population expansion. This can lead to severe malaria, massive organ failure, and in untreated cases can lead to death. So it is a severe disease, but it is a treatable disease. And it's all about killing this little parasite that is infecting your red blood cells. So this is the causative agent of all our problems in context of malaria disease. Now, we have chemical tools available or drugs that is able to kill the parasite, but unfortunately, the majority of those tools have now, as we've seen widespread resistance to all of those drugs available. So this means we can't give up because we have to treat patients that are infected with the parasite to save lives. So it just means it's a challenge for us. We have to come up with new tools continuously that are able to kill this parasite and therefore prevent severe malaria and save lives. But we also have to be innovative in using these tools in additional applications like I described just now. So our developmental challenge from an academic perspective is that we have to target this parasite. We have to kill the parasite. Unfortunately, though, this parasite is not a singular entity. So similar to or dissimilar to some bacterial and viral infections, you are only targeting one organism that you need to kill. But for malaria parasites, it's a complex organism. So in the blood stage infections that causes symptoms, we are looking at having to kill at least 4 forms of the parasite. And then this little parasite can cleverly also escape this pressure, and it can go hide away in other organs like your bone marrow. And here it can take on a different form. So it's a little bit of a shapeshifter. And in this different form, people can walk around with this form of the parasite for months at a time, asymptomatic, and they don't even know that they are carrying the parasite. But there's 5 forms of this little parasite, and this mature form is the form that can then be picked up and transmitted to mosquitoes. And again, there's 4 developmental forms within the mosquito. So for us, to target the parasite means we're not targeting one thing. We're targeting multiple forms, each with a different background and each with a different requirement in terms of therapeutic innovation. So we have to be really clever and come up with something that is going to be useful as a malaria therapeutics. So it's going to save lives by clearing this blood stage infection. But we also want to have something different that we can use as this add-on tool to malaria control strategies that's going to target these forms of the parasite that people walk around with for a very long time and block the transmission between humans and mosquitoes. And this is really the health innovations that we are working at the UPICC. So it's a complex problem that requires a multifaceted approach, but ultimately we want a simple solution. We want to have a pill that someone can drink out in the field and that hopefully with one dose can cure the patient of disease. So this requires a very interesting approach in terms of how do we handle this complex problem with a multifaceted approach leading to a simple solution. And really, in my mind, what we were very good at in South Africa in doing is that we built a huge capacity in South Africa in terms of enabling technologies and expertise in the field of malaria parasite biology, as well as malaria drug discovery. So we are really leading, not only as an African leader, but also as a global role player at the moment in this field. What we have done is we have artificial blood systems that allow us to grow this little parasite outside of human bodies. And of course, this allows us to do all the research that we can do in the lab. We have the ability and platforms in place now at the University of Pretoria, actually the biggest platform in the continent that allows us to grow these parasites, but also to measure parasite killing. And this is really important because this allows us to discover those interventions that we need to roll out into possible drugs in the future. And this is leading us also to a new development where we have an artificial mosquito feeding system that we can tap into. And at UCT, we have partnerships with the drug development platform there in terms of drug design and synthesis. And they also run advanced drug metabolism and toxicity platform. And then a new development is in terms of drug delivery and nanotechnology with University of Stellenbosch. So this was really the means to the end. We knew what we were looking for, but we had to display extraordinary leadership to establish these technologies and create this capacity development for South Africa to become a leading role player. And we could not do this at the University of Pretoria alone. We partnered with other universities and research institutions in South Africa, all playing their role in context of our ultimate goal. And just to bring this all back together, this really, in essence, is a interdisciplinary approach, and it really cemented all of those expertise, but it also allowed this integrative response between the expertise. And I'm just highlighting 4 of the research institutions involved in here. That directly translated to success in our hands. And I'm happy to report that we have now in hand chemical tools or chemical probes that we can in future develop towards antimalarial drugs. So we have new tools that we discovered, both for therapeutical as well as from transmission blocking activities, so eliminating malaria, that we reported earlier this year. And this was a breakthrough that the media was very happy about, and several reports came out. But what I just wanted to highlight from some of these reports was actually some of the titles that I really thought was appropriate in context of tonight's talk. In not just the discovery, that's important, but this teamwork and infrastructure behind the local malaria discovery. And could the teamwork lead to malaria eradication? And I said, that's our aim. It's, that's what we'd like to do. So it really emphasizes the importance of transdisciplinarity and leadership working towards a singular goal, and the fact that it can lead to these health innovations. So this is not just ending there. It's not just the fact that the scientists in leading institutions in South Africa is working together. We took the lead at the University of Pretoria then to share this information and share this interest and learning towards a common goal. And we generated a community of practice. In essence, it was cementing these expertise and transdisciplinary approaches from 4 of the leading universities in South Africa, and it cemented the research chair activities in these universities. And it coordinated the efforts towards this transdisciplinarity research platform. But what this community of practice allowed us to do was to have a singular vision. And our vision cements then those critical development paths towards health innovations for malaria in South Africa. And it has now extended to Africa as well as globally. We have generated a standard practice framework for researchers in malaria endemic countries to work towards malaria elimination. And we really are taking the leadership here to be able to take any of the interested parties in Africa and globally to learn and to experience our learnings and really to move forward in that manner. I do believe that our impact is really on health innovations. It is also on stakeholder interaction, so it is completely a transdisciplinary platform, and it is responsive to national and community requirements. We have all of our researchers that directly liaise either on a national or provincial level or community level to really make sure that our research as academics is responsive to the needs of the community. And in this way, I hope and I do believe that we are making meaningful societal contributions. And just to note, when we started with community practice 2 years ago, we started with about, the 5 key members in the group and about 30 associated members. And we have now grown 10-fold in the past 2 years with an absolute African and global footprint. So we have more than 350 partner researchers and students, importantly, postgraduate students as well, that are involved in this community of practice. So this is really, in my mind, an example of where transdisciplinary solutions can lead to leadership and hopefully simple innovations for a complex problem. And if I just summarize this to finalize, why I think part of our factors for success is that we have a singular focus on the parasite itself. We then bring together experts from different backgrounds and different disciplines. We then cement this together in terms of funders and investors, but also institutional advancement for these key research areas within our leading institutions in South Africa and Africa as a whole. And we are really responsive in our research in terms of the community needs, the provincial and national government needs. And like I said, we directly liaise with those provincial and government bodies. as well as we establish global partnerships. And I'm just highlighting two here that we very closely work with, and that's WHO and the MMV, which is the Medicines for Malaria Venture. And by doing so, we are responding directly to multiple of the SDGs. Of course, we are contributing directly our research to SDG 3 in terms of good wealth and health and well-being. Ultimately, we want to contribute to no poverty, but I think this community of practice and our leadership in this context of taking academic research into applied research and making it of importance to society just shows how far partnerships for the goals can take us. So my last slide is just those key learnings and success factors that I'd like to summarize. And I think that some successful leadership in scientific coordination is possible, and it is possible to take academic research into an applicable and important transdisciplinary outcome. But this requires thought leadership, and it requires an absolute vision and initiative to take these researchers and scientists that are sitting in their own little disciplines and bring them together to address really a singular focus. And I think what's really important is for this thought leadership and what we try to achieve, and I hope I gave an example of what we did achieve, was to then bring this together and have a singular focus. And it was important in our context that the singular focus is African-centered, but globally relevant and leading. You have to have, if you're trying to address any of these or attempt any of these type of collaborations and big consortia and community of practices, you have to have motivated member participation. It is extraordinarily important that these people want to be there and work with you towards a singular goal. And also that the expertise that's being contributed is completely complementary, but also is able to cross-pollinate and support these interdisciplinary and transdisciplinary approaches. And then lastly, if we do all of this together, I think I've shown hopefully an example of how we can then, this results in meaningful outcomes driven by societal needs. And that is it from my side. Thank you very much.
Thank you so much, Professor Burkholz. Whenever I listen to a talk like this, I am just overcome with gratitude that there are people like you who are absolutely at the top of their game and really committed to making an impact in society. Thank you so much. That was fascinating. Just before I introduce our next panelist, I would like to invite all our audience members to please put your comments in the chat. We would really love for our panelists to engage with you towards the end of the webinar. So as the questions come up, just please put them there and we will communicate them to our speakers. Our next speaker, Professor Veronica Uckerman, is in the Department of Internal Medicine at the Faculty of Health Sciences at UP. She's the acting HOD for infectious diseases and head of the COVID-19 response team. She's a critical care specialist, physician intensivist, and adjunct professor at the Department of Internal Medicine, UP. She's currently the acting head of department, as I've said, of the Division of Infectious Diseases and heads up the COVID-19 response team at Steve Biko Academic Hospital. She's busy finalizing her PhD in infectious diseases. Professor Uckerman, her research interest is quite broad, and it touches on the diagnostics and clinical aspects of various infectious diseases, including HIV/AIDS, tuberculosis, and COVID-19, including the interaction and co-infection prospects and effects of these diseases. This is going to be fascinating. She recently started looking into collaborating on malaria research with various UP experts. Professor Uckerman will introduce us now to human health and the influence of infectious diseases on health, specifically looking at malaria and the COVID-19 disease. She will touch on her experiences in her role as head of infectious diseases and how important collaboration across sectors or disciplines are in this scenario. She will also address challenges of malaria diagnosis and treatment during the COVID-19 pandemic and the need for strategic leadership. Professor Uckerman, thank you so much. We are very happy to have you.
Thank you, Dr. Steenkamp, and thank you to the organizers for the opportunity to speak today. I'm going to have a little bit of a different viewpoint or stance because I'm a clinician. So a lot of what I do is actually at the patient front, and really I have the privilege of seeing how research then really does translate to the treatment of my patients. So just a little bit of background. What you see here is the Professor Anton Stolz COVID ward. It's our COVID ICU and high care, named after the visionary of infectious diseases who has left us, unfortunately, but really where I've spent the majority of the last 18 months of my life in this pandemic. This is just a look inside, and I always have to smile when I see this photo of our empty ICU, because at the start of the pandemic, we thought that we were going to cope with one ICU. Since we've actually had to open 3 ICUs, multiple high cares, and we've turned our entire Tshwane District Hospital into a COVID unit. But on the right-hand side is a photo of some of my team members, and what a privilege it is to lead such a committed group of people. And I think really that's where transdisciplinary for us starts on the floor, because for us to have managed this pandemic at all and looked after our patients, we've literally had to use, pull resources from everywhere. So we need the frontline research, but we also need the clinical team, we need the nurses, we need the physios, we need the dietitians. So translational, certainly in a clinical sense, COVID-19 has been a great example of that. Also, I think the pandemic has been a great opportunity for innovation and leadership. And within this unit, we don't just perform clinical work, we've also performed numerous research activities. We've been part of international trials. We've got ongoing work in COVID immunology. So it's really been a great opportunity for us. So you might wonder how on earth malaria and COVID come together, and if I'm just trying to beat the lizard to look like a crocodile, but in fact, it's not. And the first slide that I'd like for us to look at is a lesson from history. So the Ebola outbreak in 2014 in Guinea, there was a lot of focus on the pandemic, obviously, initially, and malaria sort of went by the wayside. So what you can actually appreciate here is at the start of the Ebola epidemic that was declared, if you look at 2014, which is the blue graph, there was significantly less malaria cases diagnosed. And in fact, in 2015, retrospectively, there was an editorial in the Lancet where they said that malaria actually killed more patients during that outbreak than the disease itself, which was Ebola. So it does beg the question, how does COVID-19 affect malaria? What is the interactions? And I really hope to use this model of COVID and malaria to show you what transdisciplinary research and innovation really is about. So let's first look at what COVID-19 did to malaria. And I've just tried to summarize certainly what we've seen. So it's the good, the bad, and the ugly. There was reduced mobility and cross-border movement. So my hospital is based in Tshwane District, and the area that is not endemic for malaria, and a lot of our malaria cases are in fact imported. So in terms of reduced mobility and cross-border movement, we were expecting to see less cases. However, if you look at the situation in South Africa globally, we really were looking at a shortage of staff. Everybody is sort of moved towards the pandemic response. We have a massive increase in the demand on clinical services, and that does beg the question, what happens to the malaria preventative strategies, the screening in communities, patient presentation to healthcare facilities? The economic impact of COVID-19 has certainly been felt in every single part of our daily lives, and malaria is no exception to the economic impact of COVID-19. Many of our research activities have been halted. Many of our resources have been distributed towards caring for those who have COVID-19, and that impacts on our future goals of malaria elimination. There's also been interruptions of supply chains and preventative efforts. Getting hold of our usual supplies, certainly in the first wave, was really difficult for many of us. We also had massive repurposing of malaria drugs. So at one stage, even the availability of medication became an issue. And then we also had closure of elective services. Now, what we found in this pandemic is that people have become more and more afraid of presenting to healthcare facilities. And because of this, we're seeing patients a lot later with more advanced disease. We're not seeing them at all. So the impact really of COVID-19 on malaria was significant. So what does the literature say? Really, because of the similar symptoms of COVID-19 and malaria, there might be a lot of misdiagnosis. So I can attest to this myself. As infectious diseases, we were consulted for a young patient who had been through 3 different hospitals. All 3 hospitals reported her COVID-19 test as being negative. But if you actually listen to the patient and where she came from, it was very clear that she was at risk of malaria. And it took 3 hospitals later to diagnose her with malaria. And at that stage, unfortunately, she had very severe disease. There are actually many papers published on malaria and COVID-19 in sub-Saharan Africa during this pandemic. And really, it starts with the epidemiologists. So they are our first members of the team, where they looked at modeling predictions. And they were predicting significant increases in malaria cases and deaths attributable to the pandemic. And the reasons stated were reduced access, medication availability, and of course, like I mentioned, the halting of our preventative campaigns. Fewer countries actually provided annual data on malaria cases and deaths in 2020 if you compare to the preceding years. Now, this becomes globally very, very important because it gives us an indication of how focus was redirected and how malaria, TB, many other infectious diseases, which really are critical in sub-Saharan Africa, had to take a back seat to the global pandemic of COVID-19. In areas where malaria is highly endemic, there were decreased cases of malaria reported in healthcare facilities, and we will touch on the reasons for that. But significantly, there was an increase in the number of malaria deaths in all the countries who reported. So if you look at COVID and malaria co-infection, which is another interesting concept, Uganda did a prospective study of their PCR confirmed COVID-19 cases, and they screened for malaria in these patients, and they actually found a prevalence of 11.7%. Again, this is quite an important finding because our initial concern was that malaria could be missed due to COVID-19, but co-infection became something that was more prominent later on and a theme we had to consider. The highest prevalence of this co-infection was in your 0 to 20-year-old age group. The confusion and vomiting symptoms were more frequent with co-infection. However, there wasn't an increase in mortality in those that had co-infection with malaria and COVID-19. And perhaps this was the first signal that made us wonder how these 2 diseases are in fact tied to each other. Previous infection with falciparum malaria in this study was also associated with less severe COVID-19. And this certainly is an unexpected link that we found in the literature. This map illustrates quite nicely. This is cases in Italy. And what you're looking at really is the percentage of COVID-19 cases on graph A, or on map A, and on map B, you're looking at COVID deaths. And you can see the 2 are almost a mirror image of each other. And this is really a very interesting signal. And it's this signal that I would like to discuss in terms of translational research, transdisciplinary research, where various parties had to come. The clinicians realized that this was an entity. We picked that up at the forefront, but we needed our scientist colleagues really to be able to explain this. So the lower than expected prevalence of COVID-19 in malaria endemic regions, the first thing, of course, that we thought of is that perhaps it's related to health infrastructure. There should be bias by age and underreporting. But even when you considered these bias factors, there was still a definite association. The first thing we have, as clinicians, thought of was hydroxychloroquine. And this is a medication that early on in the pandemic, we thought could potentially be used for COVID-19. However, since we have seen that it's not, but we do know that it interferes with various inflammatory pathways. So one proposed mechanism at that stage was to say that perhaps the widespread use of hydroxychloroquine could be influencing the results that we see. Artesunate is also currently studied as a repurposed drug in COVID-19, and this is specifically in Solidarity trial. So again, perhaps medication was the link. However, if we turn to our hematologist colleagues, they found an interesting association between blood group and severity of SARS-CoV-2, which is your COVID-19. And they found that the blood group O is associated with the decreased risk of SARS-CoV-2 infection. Now, if you go back to malaria, there was a meta-analysis done that actually showed an increased odds ratio of severe Plasmodium falciparum among individuals with blood groups AB, or non-O, as compared to blood group O. Again, there seems to be this link between blood group O, severity of malaria, and severity of COVID. It's not just the hematology colleagues, however, who had an answer to this. Our chemical pathology colleagues also found some interesting trends. So the ACE2 receptor, and I'm not going to go into too much detail, but this is basically the receptor that allows COVID-19, the virus itself, the SARS-CoV-2 virus, to enter the cell. And in malaria, this receptor and its downstream enzyme, angiotensin II, has a very important role in disease severity. And what is interesting is if you look at polymorphisms in that receptor, in other words, genetically modified versions of that receptor, in both COVID-19 and in malaria, you will see that in areas where there's high incidence of malaria, and this is, for instance, the Middle East, as you see now, or Africa, as I'm circling at this point, those areas where there is a lot of polymorphism found in this receptor were associated with less COVID cases. And again, that link between severity of malaria and COVID-19 is found, but this time it's on the chemical pathology forefront. We will give our immunology colleagues a turn too, because malaria produces certain antibodies, we call them GPI antibodies, and they act by stimulating white blood cells and triggering inflammatory responses. And most of you will know that one of our biggest problems clinically with COVID-19 is that inflammatory storm, that huge inflammatory response that we see. And it has been found that SARS-CoV-2 also has various glycoproteins that could be identified by these antibodies. So if you've had previous malaria, and specifically falciparum malaria, the chances of having these antibodies and then those antibodies recognizing the SARS-CoV-2 virus on presentation is certainly another way to explain this link. So what about the future? I think the future of malaria really involves transdisciplinary leadership. And I think in sub-Saharan Africa, the COVID-19 pandemic really has delivered both our clinical services, our preventative attempts, and our interventions when it comes to malaria. Consequently, we've seen significant increases in malaria morbidity and mortality. I've looked at my own institution's data. If you compare 2019 to 2020, we had a third of the cases in 2020. But unfortunately, if you look at percentage of mortality, that was double of what we were seeing before. The patients that we were seeing were presenting really late. And that was a combination of factors. The first factor was access. Many of our emergency departments are extremely full. Patients present late. Patients are scared to present. And then, of course, we have decreases in our diagnostics because many patients first have to undergo screening for COVID-19. Co-infection was not considered. And after I saw these stats in our own institution, we actually went about an awareness campaign on our COVID-19 platforms to clinicians saying, please don't forget the other diseases. Don't forget that fever, vomiting, diarrhea, headaches, myalgia, all these things can be malaria. It doesn't have to be COVID-19. And we can get co-infection. Similarly, with TB, we've had to remind our clinicians not just to think of COVID-19. The challenges for sustaining malaria vector control are multiple, and you've heard about vector control in the preceding talks, but certainly implementing these during a pandemic are a lot more difficult and really has taken a lot more innovation to be able to sustain these vector control platforms. There is really a major need for commitment and leadership. This leadership starts at governmental level, but it seeps right down to the clinician who is patient-facing. And again, we need it on the forefront of research, of public health efforts, of preventative efforts, and in early recognition and appropriate management of these patients. The cost of the pandemic has not just been at a clinical level. I think for all of us, we know that our research has been halted to some degree by the pandemic, by COVID-19. And the effect will actually translate, of course, into malaria as well. We all know about our goal to eliminate malaria. We know that we want to get there as soon as possible, 2030, our goal. And I think the setback that the pandemic has posed to that goal will really become evident in the years to come. We really need more adaptable and innovative approaches to support the implementation of research activities during that time. We've all had to get really creative with online platforms, with alternative means of doing field research, getting our supplies out, implementing what we're doing in the clinical field during this time has been particularly difficult. So in a nutshell, I'm presenting to you guys the clinician forefront, where really COVID-19 and malaria is just one example where so many disciplines come together at the end of the day to the benefit of the patient in front of us. I'd love to keep the conversation going. If any of you have any comments, queries, or further discussion around this that we won't be able to get to, this is my email address. And I thank you for your time and the opportunity to speak at this forum again. Thanks.
Professor Uckerman, thank you so much. That was fascinating. And who would have thought of so many interlinkages between malaria and COVID-19? I'm sure there will be questions afterwards from the audience. And on that note, please, may I remind you to put your questions in the chat function. Our final speaker is Dr. Mthokozisi Sibanda. And I have to confess that I heard Dr. Sibanda speak, it must have been 7-8 months ago during a different webinar. And I thought to myself, oh my goodness, I have to get him to speak to our MDP students because it is such a great example of intersectoral collaboration and innovation, in this case for malaria elimination. So Dr. Sibanda, you are very welcome. To introduce him, Dr. Sibanda is the CEO at African Applied Chemical Limited. That's a South African company. He has a PhD in chemical engineering, specializing in polymers, I hope I pronounced that correctly, and chemical product design from the University of Pretoria. He has always had a passion and a keen interest to turn scientific knowledge into usable products. During his academic research career at UP, Dr. Sibanda contributed significantly to novel and innovative malaria transmission interventions. The research group he was part of made a scientific breakthrough in the slow release technology of liquids from fabric yarns. This led to the founding of his startup company called African Applied Chemical, which applies chemical engineering technology to solve problems in Africa. Dr. Sibanda will introduce the audience to the malaria mosquito vector, how research and scientific knowledge can contribute towards developing novel and innovative vector control interventions, and the prospect of taking these products beyond academia into industry where we need them. He will focus on the importance of innovation and what is needed to move from an academic environment to CEO of his own company. Dr. Sibanda, the floor is yours. Thank you so much.
Thank you very much for this opportunity to give a talk in this webinar. Well, my title is Development of Innovative Vector Control Tools for Mosquito Control. And before I dive into this presentation, I just want to give a little background of how I transitioned from being a researcher to an entrepreneur commercializing one of the technologies that we developed under the UP Institute for Sustainable Malaria Control. I joined the University of Pretoria in 2009 as an honor student under the supervision of Professor Boltafoke. And, sometime during my master's studies, I confided in him to say, my ambition is to become an industrialist. And he held on to that word because sometime during my PhD, I received a job offer in the coastal city of Durban. And I just wanted him to give a reference to my prospective employers. And I send him an email to say, look, I've got a job offer. Can you just send in a reference to these guys? And then he called me to his office. We had a lengthy meeting. And the biggest thing that came out of that meeting was to say, you are thinking too small. You must think very big. So as fate would have it, I didn't take up that job offer and continued with him until I completed my PhD studies, went over to postdoc. And during the postdoc, we developed a very nice technology that I'm going to talk about here. I took it to the markets. And inside, for me, thinking big, it really meant that we shouldn't stop at just discovering these nice new technologies, but we have to put an effort to take these technologies to the market in order for them to start helping people. So during my time as a researcher at the University of Pretoria between 2009 and 2018, the work that we've done together, the papers that we've published, I'm going to talk about number 7, bicomponent fibers for controlled release of volatile mosquito repellents, and how we're applying that technology to develop, or rather to manufacture innovative products and they were extending that technology towards the manufacture of very high-tech mosquito nets. Okay, so this is just the overview of the presentation. I'll talk about the mosquito and disease that it transmits, that has been discussed by previous presenters. I'll go deeply into the problem of continued malaria transmission and propose the innovative products that can be used to mitigate the problem of continued malaria transmission. So Prof. Tian has spoken in detail about the burden of malaria in Africa. It's a very nasty disease that affects mostly children under the age of 5. And we really have to make a sustained effort in coming up with new tools to reduce the burden, disproportionate burden that is on Africa due to malaria, okay? And we've also discussed the different clusters. The previous presenters presented on parasite control, and we are more involved in vector control. And during my period where we were doing research under vector control, worked with entomologists. One of them, Professor Leo Bragg, I think is in Thailand right now. And he gave us very good pointers on which direction to take in terms of developing innovative products to deal with mosquitoes. Okay, so this is a scanning electron micrograph of a mosquito, beautiful creature, but is involved, is responsible for terrible suffering on the African continent currently. It not only transmits malaria, but other diseases such as dengue, chikungunya virus, yellow fever, and the Zika virus that caused a lot of problems in South America not so long ago. So the problem that we're facing is the WHO has put a lot of effort, and they've done very well alongside donor funders such as the Global Fund in pushing in very innovative, very effective vector control tools. And from 2000 right through to 2010, we saw a steady decline in malaria cases. But we've seen around 2013, the cases reached a plateau and they stopped reducing, and the cases are actually starting to increase. And there was a debate within the scientific community, and the conclusion was to say the problem is because of one, outdoor malaria transmission, because the tools that are currently used to control vectors are used indoors. and they select for indoor feeding and resting mosquitoes, whereas there are no effective tools for outdoor feeding and resting mosquitoes. And we've seen the emergence of pyrethroid resistance. Pyrethroid insecticides are the most commonly used insecticides for mosquito vector control. And one of the reasons why mosquitoes are still with us for all these years, millions of years, is their ability to transform themselves physiologically and build mechanisms to resist threats around them, including insecticides that are used on them. So the need really is to come up with new tools that will bring in a quantum leap in terms of effectiveness for us to start dropping this graph of malaria cases worldwide. Prof. Tian is talking at length about the different vector control techniques. South Africa favors IRS using DDT. The rest of Africa favors the use of mosquito nets, LLINs. To a certain extent, the WHO also recommends the use of larviciding in biological control and environmental management. Okay, so I'm going to speak to you about an exciting technology that we developed in collaboration with the Institute for Polymer Research based in Dresden, Germany, with the Department of Chemical Engineering and Professor Leo Bragg under the UPIS-MC. And this technology basically will make a fiber, specially engineered fiber, and this fiber will infuse high amounts of volatile liquids. And what the fiber does, stores the liquid inside and slowly releases tiny bits of the liquid into the surrounding atmosphere over a long period of time. So I didn't want to go too much into the details of techniques of how we actually achieve that. But if you just keep in, if you just know that the fiber stores high amounts of liquids and slowly releases small amounts over a long period of time. And the effect that this has is it extends the residual effectiveness of those liquids. For example, if you infuse insect repellents, if you apply an insect repellent directly onto your skin, it will last for an hour or two and lose effectiveness. But the way we've done it here is we've managed to extend the residual effectiveness of a repellent, for example, to the order of months, as I will discuss in the next slides. So we've protected this, the University of Pretoria is taken patents within South Africa and also the Aripo region. Okay, so still also, it's just what we do is we spin fibers. So the first picture is the roll of fiber that we have made infused with liquid. If we take a strand of that fiber and cut it and look at it under a scanning electron microscope, this is what you see on images A and B. Image A being a fiber that has no liquid inside, and B being a fiber filled with about 28% of the liquid inside. Okay, where are we making this fiber? We're making this fiber at the Nanomaterials Industry Development Facility, right here at the CSIR in Pretoria. Employ about 7 people who work directly on operations. We rent this special fiber spinning plant from the CSIR, but we've added some small pieces of equipment, a fiber rewinder, and a fiber cutter. The fiber cutter allows us to give us capability to manufacture what's called a non-woven textile. If you've used wet wipes before, that's a non-woven textile. It's a very cheap textile, and it gives us flexibility in making very cheap products that can be deployed in resource-limited communities. For example, you can make a bed cover made of non-woven technology using the non-woven textile, and such bed covers have been shown, if you infuse them with the pyrethroid and the synergist piperonel butoxide, have been shown to be very effective in preventing mosquitoes. For people who are not sleeping under mosquito net, at least they have to put that bed cover over them if, for example, they're sleeping outside. Okay, so what are the commercial applications of this technology? So as I've mentioned, we have applied the technology in the manufacture of long-lasting insect repellent textiles, and I'm going to also share with you the work that we have done so far in applying this technology towards development of next generation mosquito nets that hopefully will give a quantum leap in terms of effectiveness in reducing mosquito populations. So what's the idea of, or what's the concept behind preventing outdoor malaria infections? This work was done by Professor Leo Bragg and published two key papers in 1994 and 2013, where he showed that outdoor feeding and resting mosquitoes prefer to bite on the ankle and feet area 93% of the times. And if they are not successful in feeding on the ankles and feet, they tend to move to the next person and attempt to feed on the ankles and feet. So they don't attempt to fly high up and find an area where they can start feeding. So this gave us an idea that if we can develop a device that you can put around the ankles or foot area, and that device is a long-lasting insect repellent effectiveness, that device can reduce mosquito bites on the ankle and foot area and lead to a reduction of malaria infections due to outdoor mosquito bites. So this is a picture that was taken in the field. As you can see, these little buggers really love the ankles, and the theory behind is they are attracted by foot odor and they follow odor cues to the ankle. On the right-hand side is actually my foot when we're doing one of the testing at the insectary at UPIS MC. So in the initial stages, when we developed this technology, we infused the fibers with the insect repellent DIT. And we made a simple prototype sock. The idea that the sock can cover the ankle and foot area. And we did testing, extensive testing on the prototype sock that was infused with DIT. And we found that it is effective for 8 months in the open, and it can last up to at least 25 cold washes. So I'm just going to show you a video. In this test, you insert your feet into a cage with about 300 female, hungry female mosquitoes. And these mosquitoes, on one foot, you wear a control sock. This is an untreated sock. And on the other foot, you wear a repellent sock. And when you put your feet into the cage, the mosquitoes have to make a choice on which foot to feed on. And as you can see in the video, they are biting through the control sock, but struggling to approach the repellent sock. So we are very excited with this technology, and it's prompted me to really try and think big, in the words of Walter Fokke, and take this technology to the market. We're currently manufacturing long-lasting insect repellent hiking socks. We also make ankle bands that are made out of this fiber, and we supply this to the tourist market in the Kruger National Park at the Tovis Destination Retail, and was busy working on expanding the distribution of these products in South Africa and the rest of Africa. We also have a field test that is happening at the moment, where we use the fiber to manufacture long-lasting insect repellent sandals. And this field study is currently being carried out in Mozambique, and we hope we're going to get very good results in the field of the performance of these products. Okay, so we thought to ourselves, what else can we do? You know, what else can we apply this technology to? And really, the next problem was the problem of mosquito resistance to pyrethroids. You know, you can reduce that resistance if you use a pyrethroid insecticide in conjunction with the synergies called piperonil butoxide or PBO. And you have commercial mosquito net products that are being supplied under WHO programs that contain pyrethroid and PBO. But the problem is they fail to resist multiple washes. These mosquito nets need to withstand about 20 washes as set by the WHO, but studies have shown that most of the mosquito net products, the PBO washes out too quickly before they reach the 20 wash period. And again, the WHO has put out a call to say they need new actives that they need to be incorporated into these mosquito nets in addition to pyrethroids. But these actives have to be safe to humans, but are toxic to mosquitoes. So we came up with 2 products that we're working on. As a piperonil butoxide infused mosquito net. We believe that using our slow release technology, we can infuse piperonil butoxide in such a way that it can resist multiple washes. And we have shown, as I'll show in the next slide, that we can infuse high amounts of piperonil butoxide, and those high amounts will play a key role in resisting the multiple washes. The second product that we have proposed is, in addition to PBO, we are going to add a novel active called nut carton. Okay, nut carton is currently used in the food flavoring industry. It's used as a food flavoring agent, so people eat it, but we've managed to show that nut carton is very toxic to mosquitoes. And the good thing about this active has not been used in agriculture, so chances of mosquitoes building resistance to it are very low. So just share a snippet of the results. We have shown that we can infuse our fibers with up to 28% piperonil butoxide. The current commercial products can infuse up to 2.5 weight percent. And we believe that that is a very small amount if you want to resist multiple washing. And using our technology, we can infuse 3 times that amount. And incorporating the slow release technique, we believe that we can easily exceed the 20 washes that are stipulated in WHO, and we're busy working on that. And on the nut carton, we've done assays on this new active that we want to introduce. We've done the assays on Anopheles arabiensis and Anopheles funestus, and at about 111 milligrams per square meter, we get 100% mortality of 3 strains: susceptible, tolerant, and resistant strains. So we believe that if we work hard enough, we can put this all together and come up with a very strong set of tools that can give that quantum leap in terms of effectiveness. So in conclusion, I just want to say it's extremely important to translate academic discoveries into the market in order to achieve set goals, set SDG goals, and multidisciplinary collaborations, such as the ones at UPI-SMC, are very critical in coming up with very effective vector control tools. And we believe that we've got a set, with the knowledge that we have from this multidisciplinary collaboration, we have enough information to come up with very strong tools to put into the market in the near future. So thank you very much for your attention. I would like to acknowledge these different organizations, and thank you very much for attention.
Thank you so much, Dr. Sibanda. I think the work that you and your colleagues do is fascinating, because, and I'm speaking from memory here from the previous presentation, so please correct me if I'm wrong, but it springs from some of Professor Tian's research regarding insecticides having a negative effect on people. And so it's better to prevent malaria using a repellent. But then again, speaking of transdisciplinary work, the behavioral problem with this is you can put repellent on yourself, you know, using a spray or whatever, but then people don't reapply every, I think you said 2 or 3 hours, and therefore they still can get infected, right?
Yes, that's correct. Yeah, in resource limited communities, people do not have the luxury to reapply the insect repellent because it becomes expensive for them. So you rather have a technique where they apply once and it stays long, or have a long-lasting effect.
Hence the socks.
Yes.
Okay, thank you so much. We actually don't have any time for questions left, but I'm going to let us run over just a little bit in order to allow for some questions from the audience. There's one, Dr. Burkholz, that I'm going to direct at you. The question is, it sounds like just with the SDGs, one really needs a very holistic, systemic view of reality and understand that one intervention may have undesirable and sometimes unforeseen effects on other SDGs. The question is, Do you think this calls for a specific kind of leadership? And the question is referring to when you spoke of the developmental challenge, meaning that this mosquito, the vector, or the parasite sort of shapeshifts into various forms, and you have to have this holistic view when treating it. So do you think from such a systemic view that is required for treating both malaria and implementing the SDGs, do you think this calls for a specific kind of leadership?
Absolutely, and I think it's not a clear-cut approach, really. In my opinion, you need to have a reductionist view first, and then expand from there, because that reductionist view is going to provide you the detail, but it does not provide you necessarily the context. So to move from that reductionist view and that expertise that individuals and individual disciplines can contribute towards anything, whether it's malaria as a disease or the context of SDGs, the SDGs in totality, is important. But then you need to step back. You need to have that ability and that vision and that thought process, really, to be able to look at this systemically. I think there's so much connectivity that gets lost by not doing so, and it's really important. And I think that's why Prof. de Jager's first slide, where he showed the interconnectivity between the SDGs, is so extraordinarily important. I think malaria is just a brilliant example of how this can be integrated, but it has to be a systemic view to be able to be impactful in essence.
Thank you so much. And then if I can ask a question to Professor de Jager also on that first slide, it was very clear from that slide that this understanding that fundamentally the SDGs are interlinked really affects and determines the way that the Institute goes about its work. So my question comes sort of from the other side. What would be lost? What would be lost in terms of effectiveness if you failed to have this understanding, this holistic view? If you had a very simple, reductive, as Professor Bergholz has said, understanding.
Thank you. Yeah, I think it's an important question. When we look at the SDGs, and we look at the vision of our institute, we specifically state that we focus on safe, sustainable malaria control towards elimination. Now, the example is some of the compounds that we're using, or that were specifically used in the past, had an effect on also SDG 3. So you're trying to improve health, and now you use something that's going to affect health. So it's not just the different SDGs, but it's also your approach that might affect the same SDG. Food, nutrition, well-being. In most of our projects in the malaria areas, we do a 24-hour food intake and various other aspects. To make sure that we don't leave something critical behind where there might be malnutrition that can result in stunting or other effects. Another example, I think, about the holistic approach is one of our flagship programs, RESMARCA, Remote Sensing for Malaria Control in Africa. So it's a collaboration, once again, with the French National Space Agency, the South African Weather Services, and many more partners, European universities, where we use satellite technologies to look at climate change, the cross-border movement that we said is important and where the parasite might come in, but also the vector control. So it's once again a holistic approach that we take. And that links now once again to your SDG related to climate. So it is an integrated approach, and you cannot move forward by only looking at one aspect, because some of the mechanisms involved are complex. Therefore, you need to get all the expertise from the different disciplines together and have a more holistic approach. And that, by doing that, you address the other SDGs as well.
Exactly. Thank you so much, Prof. de Jager. Professor Uckerman, I have a question for you from the audience. With reference to the graph on Ebola and malaria morbidity and mortality, would you say a lack of proper management is a possible reason as to why pandemics such as Ebola and COVID-19 impact on malaria in such a way?
Thanks for that question. I think, again, proper management is a part of it. I think any pandemic, any outbreak is a very complex situation. So first of all, it's not something we usually have years to prepare for and set systems up for. Certainly management is one of them. Secondary, I mean, we've spoken about patient responses, patient presentations. Again, if you think of Ebola, malaria, very similar presentations, isn't it? I mean, fever, they've got bleeding tendencies. Similarly with COVID and malaria, and it seems like a lot of the cases where malaria was missed and misdiagnosed as COVID were typical symptoms like fever and body aches, etc. So I think if anything, it speaks to this idea that at various levels, so it's the clinician at the forefront who needs to remember that it's more than just the pandemic, which is actually quite difficult because when you're inundated with one thing all the time, it's in the media, it's in every single meeting you attend, you're so focused on that, you literally have to take a step back and think of other things right up to the level where we need strong leaders and advocates for these diseases that get missed, that sort of, raise the flag and say, don't forget about these diseases, they haven't gone away. And yeah, it would be very interesting to see if we're going to see similar trends with COVID and malaria.
Thank you so much. And then Dr. Sibanda, a final question for you. Actually, I'm going to combine two questions. The one is a serious question and the other one is more a fun question, but someone just took it out of my mouth. The first part of the question, from your international collaboration and your collaboration across sectors to address this problem, what have you learned about leadership for implementing the SDGs? And then the follow-up question is, one of our viewers would like to know, is the repellent sock available in the South African market? And if yes, where can it be accessed or purchased?
Okay, now thank you for those questions. Yes, I think the most important thing about leadership is to be open, open to collaboration, open to allowing other people into your networks. And, at the end of the day, the more the merrier, the more the researchers that are in there, the stronger the collaboration. So I learned a lot working with Walter. To collaborate with the Europeans, it was his contacts. He gave me the contacts and said, talk to these people, I've worked with them before, they know me, use my name to advance the goals of developing this technology. And for him to do that, I appreciated it so much. And he did that to all his students. So it's very important to have a giving take to it, to allow your students or whoever you're working with the latitude to tap into your networks. That's the biggest thing that I learned. With regards to the socks, they are available on the South African market. Actually, they are available on takealot.com, but you can also go to our website, nobuzz.co.za. So nobuzz.co.za/shop, and you access the online shopping portal.
Thank you so much.
Yes.
At the end of such an evening, I am really left grateful that there are people like our panelists who are willing to share their gifts, their expertise, the fruits of their labor with Africa and with the world. Thank you so much to each of you for availing yourself and your time. And regarding your important work, may the road rise up to meet you. Thank you for the pleasure of collaborating with the Institute for Sustainable Malaria Control. Thank you also to our audience for your amazing engagement and participation. You've been wonderful. And thank you also very much to our technical team behind the scenes, and also to Dr. Taneshka Clear from the ISMC and Mr. Arend Carlo for your huge contribution in making tonight a very stimulating success. And with that, I wish you all a very good evening. Thank you.
So malaria still remains a very major public health concern despite efforts being made to combat malaria.
What many people don't understand is that there's no single control tool or strategy that will work alone to eliminate malaria.
Through research, we are continuously learning on the past strategies, making changes and implementing them with the target to eliminate malaria.
By establishing transdisciplinary collaboration, we also can contribute our expertise.
My research focuses on identifying and isolating pure compounds with the anti-malarial properties from plants.
Using polymer and nanotechnology, we are creating the innovative methods of safer and sustainable vector control.
In my art practice, I combine science and art to create artworks that'll engage people beyond just the research being done, that'll have an emotional impact on the people.
So each project we do actually produces new and innovative strategies and solutions to combat malaria in endemic regions. So my research focuses on controlling vectors in areas which are very high load in malaria cases.
My research project focuses on finding novel drug targets in order to fight malaria. Zero malaria
Starts with me.
Zero malaria
Starts
With me.